Hi friends, I'm Annie, your friendly health coach. Welcome to my page. In today's video, I'm going to talk to you about stroke. You can follow my health and well-being on all social media platforms. Now let's get to the topic for today. Let me briefly explain to you what a stroke is. A stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. Let us now go into the symptoms of stroke. It's important to know the signs of a stroke and get help quickly. You can call 911 or your local emergency number. Treatment is most effective when started right away. Stroke symptoms may happen suddenly. If you or someone you are with may be having a stroke, pay attention to the time the symptoms began. Some treatments are most effective when given soon after a stroke begins. The number one symptoms is you will have trouble speaking and understanding what others are saying. A person having a stroke may be confused, slur words, or may not be able to understand speech. Another symptom is you will have numbness, weakness or paralysis in the face, arm, or even your leg. This often affects just one side of the body. You can try to raise both arms over the head, or if one arm begins to fall, it may be a sign of a stroke. Also, one side of the mouth may droop when trying to smile. Another one is you have problems seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Another severe symptom is that you will have headache. A sudden severe headache may be a symptom of a stroke, like vomiting, dizziness, and a change in consciousness may occur with a headache. And my final symptom is that you have trouble walking. When you have a stroke, you will stumble or lose balance or coordination. Let me also tell you what causes a stroke. A stroke is caused when blood flow to your brain is stopped or disrupted. There are two kinds of stroke, ischemic and hemorrhagic. Ischemic stroke is the most common type of stroke. It happens when a major blood vessel in the brain is blocked. It may be blocked by a blood clot or it may be blocked by a buildup of fatty deposits and cholesterol. This buildup is called plaque. Hemorrhagic stroke occurs when a blood vessel in your brain bursts, spilling blood into nearby tissues. With a hemorrhagic stroke, pressure builds up in the nearby brain tissue. This causes even more damage and irritation. Anyone can have a stroke at any age, but your chance of having a stroke increases if you have certain risk factors. Some risk factors for stroke can be changed or managed, while others can't. Number one risk factor is high blood pressure. Blood pressure can damage blood vessels or arteries that supply blood to your brain. Number two, heart disease. Heart disease is the second most important risk factor for stroke and the major cause of death among survivors of stroke. Heart disease and stroke have many of the same risk factors. And the third one is diabetes. Who said diabetes? Yeah, cancer. So people with diabetes are at greater risk for stroke than someone without diabetes. Another one is smoking. Smoking almost double your risk for an ischemic stroke. The other one is birth control pills or oral contraceptives. Another risk factor is your history of transient ischemic attacks. Transient ischemic attacks are often called mini strokes. They have the same symptoms as stroke, but the symptoms don't last. If you have had one or more transient ischemic attacks, you are almost 10 times more likely to have a stroke than someone of the same age and sex who has not had a transient ischemic attack. Another risk factor is high red blood cell count. A significant increase in the number of red blood cells thickens the blood and makes clot more likely. This raises the risk for stroke. Another risk factor is high blood cholesterol and lipids. High cholesterol levels can contribute to thickening or hardening of the arteries, which is caused by a buildup of plaque. Plaque is deposit of fatty substances, cholesterol, and calcium. Plaque buildup on the inside of the artery walls can decrease the amount of blood flow to the brain. A stroke occurs if the blood supply is cut off to the brain. Another risk factor is lack of exercise, obesity, excessive alcohol use. More than 2 drinks per day raises your blood pressure, or binge drinking can lead to stroke. Another one is illegal drugs. Drug abuse carries a high risk of stroke from blood clot, or what we call cerebral embolisms. Cocaine and other drugs have been closely linked to strokes, heart attacks, and many other cardiovascular problems. Abnormal heart rhythm is also another factor. Some types of heart disease can raise your risk for stroke. Having an irregular heartbeat is the most powerful and treatable heart risk factor for stroke. Other risk factor is cardiac structural abnormalities. Damaged heart valves can cause long-term heart damage. Over time, this can raise your risk for stroke. There are also risk factors for stroke that can be changed. For example, older age. For each decade of life after age 55, your chance of having a stroke more than doubles. Other one is race. African Americans have a much higher risk for death and disability from a stroke than white. This is partly because the African American population has a greater incidence of high blood pressure. And the next one is gender. Stroke occurs more often in men, but more women than men die from stroke. Other one is history of prior stroke. You are at higher risk for having a second stroke after you have already had a stroke. Hereditary or genetics. The chance of stroke is greater in people with a family history of stroke. Other risk factors include where you live. Another one is temperature, season, and climate. Stroke deaths occur more often during extreme temperatures. There is some evidence that strokes are more common among low-income people. So, what can you do to prevent a stroke? Many stroke risk factors can be changed, treated, or medically modified. And number one, changes to the way you live can help lower your odds of stroke and heart disease. Make a plan to adopt this healthy habit. Number one, keep tabs on your blood pressure and get it under control if it is too high. Number two, check your cholesterol. Keep your blood sugar at the right levels. If you smoke, please quit. Eat a healthy diet that includes plenty of fresh fruit, veggies, and whole grains. Cut back on saturated fat. Get regular exercise and keep to a healthy weight. Another one is don't use illegal drugs. Always remember to consult your doctor first and don't forget to take good care of yourself. If you have any questions or comments, please leave them below. If you enjoyed this video, please remember to like or follow my page. Thank you and hey, bye.